An ABC News medical contributor and emergency medical physician, Dr. Darian Sutton, joins us now to talk about this some more. So, Dr. Sutton, we saw right there in Elwyn's piece that Orange County is really getting hit hard. Your office is in Los Angeles, so what are you seeing on the ground?
We're seeing the same or similar effects that they're seeing down south or right below us in Orange County. We have rates of RSV that are incredibly high. Specifically, those highest at risk are toddlers and infants. And this is the first time in my experience during the pandemic that I'm not just treating RSV, of course, we're treating COVID, of course, and also the flu. So all three of these are slowing down the process within emergency rooms. And because of that, ERs are filling up, waiting rooms are becoming even more over capacity, and waiting times are incredibly long right now.
And Doctor, the health experts are calling the number of RSV cases in Orange County, quote, unprecedented, with the Department of Health reporting nearly 76% of inpatient beds across the country are occupied, and 72% of ICU beds are now filled. So we've got cold and flu season as well. You know, how are you looking at these next few weeks and couple of months, given COVID, cold and flu, and RSV?
Well, it takes lots of planning. Typically, RSV is associated with approximately 80,000 hospitalizations in children under the age of 5 each and every year. But the problem is that normally we see RSV around Christmas time. So the fact that we're seeing it now brings us a lot of concern, mainly because the question is this going to be an early rise and an early end to the RSV season, or is it going to be prolonged? And if so, how will that affect the patients who are also coming in, of course, with COVID and the flu? So we're trying to do a lot of public health education on what signs and symptoms to bring your child in, and of course helping everyone remain calm. Again, for most, RSV is a mild cold, but for those highest at risk, which includes toddlers, infants, and those who are older the age of 65, RSV can be quite deadly.
Well, let's talk about Pfizer and this week releasing that new data on a possible RSV vaccine for pregnant people. How significant is that?
I think it's incredibly important and significant. One of the reasons being is that we're, again, looking at the highest at risk, which is not necessarily the pregnant mother, but that child. So these vaccines have shown that not only the mother gets the immune protection, but there are some signs of protection within the child. And the goal is to keep that child away from being exposed to RSV for the first couple of years of life. I think right now what we're seeing is a lot of children were protected last year thanks to masks and distancing. But as we've all become really tired, we're starting to see these atypical rises in these viruses like RSV, flu, and COVID.
And doctor, for parents with young children, how worried should they be, and what should they look for?
I understand the concerns and the fear, especially when we're seeing a lot of these topics on the news. We're trying to understand what to look at in our child and when to talk to a doctor. Just to give some point of education, when I'm examining a small patient, I'm looking at signs of respiratory distress. Are their nostrils flaring when they're breathing? Are they grunting? Are they wheezing? Are they belly breathing? These are signs that the child is having difficulty breathing and needs to be evaluated by a provider because they might need to be intervened upon.
All right, Dr. Darian Sutton, thank you so much.
Of course.
As always.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.